Welcome to TTT Talk City 91.1 FM and TTT Live Online. I'm Wesley Gibbings with more on COVID-19. Within the last 48 hours, there have been several major developments relating to the spread and impact of the virus in Trinidad and Tobago and globally. A second case was confirmed on Friday, and further measures have been introduced by the government in an effort to contain its spread. Citizens have been asked to cancel all non-essential travel. Cruise ships have been asked to stay away for the rest of the season. And earlier today, the Labour Minister announced the introduction of pandemic leave for workers in the state sector. Schools, both private and state-supported and operated, have also been shuttered for 1 week in the first instance. It is on this point we have invited Tutor President Antonia De Freitas to be a part of today's discussions. Over recent days, we have also witnessed, as has been the case in many countries, a high incidence of panic buying and with implications for the distributive sectors. To tell us about the impact of such increased demand for consumer products and the impact of the virus on the sector, we have President of the Supermarket Association, Mr. Rajiv Dipti, who will join us a little later. But throughout this evening's discussion, we'll also have Dr. Mohammed Rahman, who is PRO of the Trinidad and Tobago Medical Association. Welcome to our discussion.
Thank you.
Thank you. Good evening.
Good evening. Ms. De Freitas, the schools have been closed for 1 week in the first instance. There's a possibility of an extension. What kind of impact on teachers, the children, and the parents of these children are you expecting to experience over the next week at least?
All right. Well, Wesley, in the first instance, Tutor is satisfied that the state has seen it fit to close the schools, at least for the period specified. That, in effect, will allow us to not only have proper information disseminated, but it would also prevent the risk of community spread, allow persons to observe social distancing and so forth. At this point in time, from March 16th to the 3rd of April, we have roughly 14 days left until the end of the term. Take away from that the one-day holiday, the 30th of March, that public holiday, as well as the actual day of SCA. Take away that day. And usually the Wednesday before SCA, there's early dismissal for preparation for the actual SCA day. So what we are looking at is roughly a period of about 12 days, 11 and a half days really, where teachers would be expected to be in contact with their students. Now, ironically, during this period from the 16th to the 3rd, that would usually be the revision and examination period for both primary and the secondary students. What we are faced with now is the fact that the final preparation for exams, internal school exams in the first instance, would be impacted upon. So teachers have reached out to Tutor and are suggesting that we shift those exams into the next term. And it has been done in the past. Additionally, we have the issue of the SE, the psychological impact on students, on teachers, on parents of any delay. However, we do believe it might be prudent to move that examination back as well in the interest of all concerned. At the secondary level, we are faced with the fact that moderation for CSEC exams have already begun. And therefore, those two would have been suspended. It means, therefore, that along with other territories around the world, around the region that have closed their schools, we will have to make overtures to CXC to have those regional exams pushed back into the new term. As far as parents are concerned, we have had challenges, even before this COVID-19 situation, of children being sent to school unwell, runny nose, fever, and the expectation is that the teachers would take care of them. And we are realizing now that practice can no longer obtain. We have teachers and students who are in the high-risk groups, the diabetics, the asthmatics, those with hypertension and so forth. We actually have 1 or 2 children who are cancer patients, cancer survivors. So that we need to, as a public, take responsibility, as the Ministry of Health has said repeatedly, for our personal well-being and the well-being of others. We would therefore want to engage the Ministry of Education in terms of planning for the way forward, our exams, the sanitization of our schools during this particular period. And we are not of the view, Wesley, that for your school, your ancillary staff will clean. For Dr. Rahman's school, his ancillary staff will clean. What we have realized and been informed by principals is that the cleaning supplies are in short supply. They're actually not able to source them at this time. So it means that perhaps between the Ministry of Education and the Ministry of Health and whatever state agencies, again, there needs to be some kind of standardized sanitization across the schools within Trinidad and Tobago. So in the first instance, those are some of the things we would be looking at.
Now, in some countries where school closures are par for the course, have been par for the course, there has been this philosophy that the lack of schools or the fact that schools are closed doesn't mean the end of schooling. What are the possibilities for Trinidad and Tobago, given what you know about the infrastructure, given what you know about the children and the communities in which they reside?
That is a fact, and we do believe, as you have mentioned, it should not be the lack of schooling, it should not be the lack of productivity. Our teachers would take the opportunity, I know, to be engaged in planning and preparation for the resumption of school whenever that takes place. Additionally, in some secondary schools, even before the COVID-19 outbreak, they would have established online platforms for online learning. So whether they're using BBC Collaborate, Edmodo, or whatever, they have the systems in place where they can reach out to their students, interact with them, teachers and students, and therefore continue. Not all schools have that infrastructure, have that system. And therefore, it would be up to the teachers, who I do believe would be responsible enough and will be willing to assist the students to create the opportunities for students to access whatever materials need to be accessed. Where there is limited connectivity, well, that is a challenge that we will have to deal with along the way. At the level of the primary schools, many of us are not so lucky to have such facilities. So I know our teachers will be creative and innovative in terms of reaching out to students and parents as far as the work is concerned.
Now, something you mentioned along the way, which would be of interest to Dr. Rahman, we know what happens in the schools, particularly the primary schools. There are children who appear to be permanently ill. The parents send them to school and they expect a level of nursing that sometimes they don't receive at home. Dr. Rahman, how widespread is this kind of problem, and do you see the current challenge as creating the possibility for some kind of legacy of greater care with respect to personal hygiene, with respect to the role of parents, with respect to households and communities?
Well, I think the advent of this COVID-19 virus has certainly taught the society a lot of lessons already. Many people have started paying attention to personal hygiene in ways that they never have before. Levels of understanding of how viral illnesses are transmitted are much better now than they were, let's say, a few months ago. So definitely there's some good things that have happened. With regards to the perennially ill child, I think that the child that is actually medically unwell and requires a lot of supervision is truly the exception rather than the rule. And I just want to touch on something otherwise. There's also the child with what we call allergic rhinitis, or sinuses or sinus problems, or allergies as it's usually referred to. And these children can very frequently have runny nose throughout the year, particularly with the Sahara dust and other pollen and dander in the atmosphere. So they can always appear to be ill. And then these children are some of the children that we have to be careful aren't discriminated against and always sent back home, and then realize that this child can't always be sick. Those children who genuinely do have complex medical conditions, they do require specialized medical care. And usually the arrangements for those children are made on an as-needed basis with communication between the specialist and the institution.
Okay. Now, Ms. De Freitas, along the same line, how is the message of COVID-19, well, schools are closed now, but in the run-up to the closures, how was that story being related to children at school? What was the approach of teachers?
Even before the Minister of Education and the Minister of Health would have visited the school last week, the teachers would have been sending the message out. I think the Ministry of Health in the first instance has been doing a pretty good job of disseminating information about the basics of the disease in terms of prevention, in terms of protocols to be followed. And that is the information that the teachers would have been stressing to students on a daily basis. I know some schools as well would have received posters and flyers from PAHO and so forth. Not all schools got it, but the information was being transmitted on a daily basis. Messages would have been sent to parents, send the children with the sanitizers, send them with their own soap or whatever it is, because we wanted to make sure everybody would have been taking the same kinds of precautions. I saw, for example, a video of a preschool in England where they made the washing of the hands into a song. And the children sang that song on a daily basis, and they could explain to you. I know our teachers would have done similar. One of the challenges that one of the things we would be concerned about, however, would have been those children with special needs who may not have been readily able to assimilate those messages, and therefore the teacher or the parent or the teacher's aide would have still been the one to have to assist the student. So we are hoping that going forward we would have special provisions for those kinds of children to ensure that they too are protected.
Now, a lot of the onus, Dr. Rahman, has fallen on the public health system. So no doubt messaging on the requirements of addressing COVID issues are very well known. You would have posters and you'll have information bulletins. But what about the private health sector? What kind of what level of responsibility is that sector accepting onto itself?
That's a good question. I'm not actually certain if there have been any guidelines written or put forward as to whether somebody should have to be in one or the other. But the public healthcare institutions are certainly the public system is certainly the way in which the government has set out for persons to be tested and to be managed further. The private healthcare system, of course, works in tandem with the public healthcare system. So what happens is that persons who may seek help primarily at a private practitioner, for example, at a family doctor, and then they may refer the situation on to the DMO for the area, the district medical officer, and then they would then determine the need for testing in that patient. Once a patient has been found to be positive, it's now a public health issue. So the public policies would take precedent to be able to determine how long and where that person should be quarantined if need be, or isolated if they were actually positive.
So, but there have been, I would assume, I think today the figure was 82 or 80 something people who have been tested with only 2 positive, and I'm pretty sure of the 80 whatever number, I think it was 82. It's 82 now. The first contact might have been with a private doctor. Okay, doc, I'm not feeling too well.
Oh, definitely.
And so what is the protocol when that happens?
So all doctors in Trinidad would be registered with the medical board, and the medical board of Trinidad and Tobago has sent out to all physicians in their purview a list of numbers to contact for the DMOs of the area, district medical officers. And once they contacted them, they would then take the pathway forward as to who should be tested and where they should proceed to, what would be the best course of action for that person. So even if the initial point of contact was with a family doctor, as we described, they would then be plugged into the public health care system.
Yeah, because people are being advised they've supplied a list of names and numbers to call, but I think given our culture, the first point of contact is very likely to be the family doctor. Okay. And therefore, as you're saying, the protocol is that the doctor would then, the private doctor would make the reference to the DMO.
That's right.
Okay. Ms. De Freitas, I want to come back to the school situation, the exams. So the SEA is coming first, and what you're essentially suggesting is that there ought to be some consideration of
having it on the due date, which is the 2nd of April.
Right now. So the Ministry of Education of Trinidad and Tobago has virtually 100% control over that. Yes. CSEC and CAPE, that's not the case.
Those are regional
examinations.
Yes.
What are the possibilities for addressing the concern that the students will probably not be properly prepared for those?
Well, again, tutor would hope that the Ministry of Education would be willing to talk with principals, secondary school principals, and with tutor on the matter. Additionally, as president of tutor, I would have been in contact with some of my colleagues from other teachers' unions around the world, around the region, sorry. And in some instances where they would have closed the schools, they too, as unions, are looking to reach out to the respective ministries of education to have them interface with CXC. So it does appear that there might be a regional approach to CXC in terms of the postponement of those exams.
Yes, and the preparedness in the event that CXC stands its ground. I'm not too sure how likely that will be, because if the directives or the instructions are coming from the member states, then they would have no choice in the matter. And most of the countries that have even those who have not detected any cases so far, because Grenada they've closed their schools, but they don't have any confirmed cases yet. They are closing the schools.
Yes.
So it's very likely that there's some space there. So what kind of intervention are you making as of now on this question of CXC and KEEP?
Well, we hope to engage our Secondary Schools Principals Association, APS and APAS, which would represent both principals of denominational schools as well as principals of government schools. And we also hope to engage the Ministry of Education to treat with the matter. So we are looking to do that, have those discussions within the coming week.
Okay. So, Dr. Rahman, back to, as we're on schools and children, what are some of the issues you see emerging with respect to treatment of children that are specific to COVID-19?
So the treatment of COVID-19 is something that is supportive. There's not a specific treatment towards it. So when we're dealing with sick children with any viral illness, it's all about supportive care, and it's about your capacity to give supportive care. Their immune systems are not always, particularly the very young, are not always as well developed as that of an adult. So they may require, for example, prolonged periods of support in certain circumstances. Also, with very young children, we haven't had as an adult a lifetime to really find out any other issues that may be going on. The children, however, with a lot of children, particularly the older, healthier ones, without any comorbidities, without any other medical problems, can actually do quite well after viral illnesses like COVID-19. And I want to reiterate something about COVID-19, and that's, remember that for 80% of people infected with COVID-19, that means about 4 in every 5 people that are infected, this remains a very mild illness. So in that 80% of people who are infected, and that would also include children and adults and so forth. So some children, if a large number of children are infected, some children may actually get very ill. But the management of the children is very similar to that of the adult in terms of just providing supportive care, oxygen if necessary, fluids and additional things as they become necessary, paracetamol and so forth.
Now, you effectively corrected me for using the word treatment, because there really is no treatment or no cure.
No specific treatment.
No specific treatment.
The treatment is supportive.
And also no vaccine.
That's right, and we probably won't see a vaccine for some time to come. And that's because, again, it takes a while to actually develop the vaccine and to make sure that it's safe and to do testing on it, and then to ship it out to everywhere afterwards.
Now, over recent years, because I can't believe that it has been so over a very long time that we've seen anti-vaxxers and people who are saying, well, these things have dangers. I'm sure Ms. De Freitas, within the school system, HPV and all of these things, you had all kinds of issues arising. You think that this episode now will kind of change people's minds about that?
As I said, there are a lot of positives that can come out of something like this, the COVID-19. And one of them is people's, some segments of the population appreciating what a vaccine is and the benefit of it. So I've seen, of course, on social media, lots of these jokes about anti-vaxxers not wanting the coronavirus, or suddenly wanting the coronavirus vaccine, whereas in the hepatitis B vaccine and Haemophilus influenza vaccine, oral polio vaccine have been around for 8 years. They don't want to take those, but the COVID one, this sounds serious. But no, I mean, the science is sound in terms of how vaccines work to prevent illnesses. And as soon as we have a COVID-19 vaccine, we should definitely go out and get it. But then, I mean, people sit and they say that we don't have a COVID-19 vaccine, we wish we had one, and then they don't have the seasonal flu vaccine. I mean, you know, I'd be interested to ask how many people nearby had the flu vaccine this year. And we're talking about the COVID vaccine. You want that one. Remember, flu viruses or influenza viruses can actually cause very serious illnesses as well.
I mean, H1N1 has cost us some lives over I think it's more than 40.
That's right. In the last year.
In the last, throughout the last flu season. Now, we're talking about and what condition this will leave us in after this. So certainly a lot of negatives because people are going to be ill, and there's a certain inevitability about the fact that it will grow. We're not going to stay at 2, but there might also be some positive leftovers, as you say, in terms of the attitude toward receiving vaccines. And in your case, hopefully we might see a new attitude with respect to the care of school infrastructure.
Correct.
And regular cleaning and creating an environment that's better for teachers and students.
Because essentially what we are looking at this point in time is, as one of my colleagues put it, a war on hygiene. It forces us now to rethink our practices as educators within the classroom and within our environment. We now have to remember that you can't touch your face and touch everywhere at the same time. You have to be extra careful. We now have to ensure as well that the public spaces in the schools are sanitized, cleaned consistently throughout the day. We have to make sure that schools have adequate funding to either purchase supplies or that they are provided with the adequate cleaning agents and supplies. We must ensure those things now. Dr. Rahman may correct me, but I don't think that even though we have the isolation going on right now, the preemptive measures, that COVID-19 will not come through Trinidad and Tobago, or it will stop. We have to be prepared for this to understand this is something we have to do going forward. And so the attitude of all of us, the stakeholders, the employer, the parents, the teachers, the children, have to be, listen, I have to take care of myself. I have to take personal responsibility. And we have to start that at the ECCE level now and take it all the way up to the secondary and the tertiary levels.
Okay, one other CARICOM country that's paying particular attention to the impact of COVID-19 is Antigua and Barbuda, which registered its first case, I think it was just two days ago. And they've taken the decision to close schools. As we hear in this report from Antigua Broadcasting Services, Garfield Burford, this discovery will affect schools with immediate effect.
Antigua and Barbuda has one confirmed case of COVID-19 so far, that announcement coming from Prime Minister Gaston Brown on Friday, March 13. The infected person is a 21-year-old woman who arrived in Antigua from the United Kingdom on the 10th of March. The British citizen went to a private medical facility the following day complaining of coughing, runny nose, fever and mild dehydration. The confirmation of COVID-19 came shortly thereafter. She's now in isolation and the Chief Medical Officer, Dr. Rhonda Seeley-Thomas, says the woman is recovering. Meanwhile, health authorities say contact tracing has already begun to find the individual or individuals who may have been exposed. They are assuring all steps are being taken to prevent community spread of the disease. Prime Minister Brown has in the meantime reiterated the call for Antiguans and Barbudans not to panic, but to be calm and responsible in responding to the threat of COVID-19. The Prime Minister says his administration has been working assiduously to keep the country's population safe. Among the measures is the retrofitting of a section of the old Hobbiton Hospital into a quarantine and isolation facility. The government says it is also close to being able to test for COVID-19 in Antigua and Barbuda. At this point, samples are sent to the Trinidad-based Caribbean Public Health Agency, CARPHA. Now, this story developing today as well. All educational institutions will be closed starting Monday, March 16 until at least the 27th of March. The Education Ministry says if the crisis persists, that closure will extend beyond the Easter break. Arrangements are also being made for teachers and other staff to work remotely. In addition, there has also been an intensification of the messaging, which is also reverberating around the world. Proper hand washing, social distancing, staying away from persons who are sick, and staying home while being sick. The public has, from all accounts, been taking heed of this crucial advice. There has been a surge in demand for sanitizing products, especially hand sanitizers, face masks, and Lysol. In addition, retail outlets have been reporting people are buying grocery items in bulk, many fearing a disruption in supply chains and the corollary impact on imports of supplies into the island. Prime Minister Brown has moved to allay those fears. During an exclusive interview with ABS News, he has indicated options are being explored to have importers increase inventory. At the same time, there is also a move afoot to increase local food production. Prisoners will be engaged in that effort. Householders are also being urged to engage in backyard farming. The Prime Minister, who is also Finance Minister, is pointing to the impact on the local economy so far, which is heavily reliant on tourism and related services. He says there has already been a downturn in tourism bookings, but insisted the government will be nimble in pursuing counter-cyclical measures to keep the fiscal accounts afloat. Part of that will include a loan from Credit Suisse. In the meantime, the government says it is likely its projections of real GDP growth of north of 7% this year will have to be revised. This is ABS TV's Garfield Burford reporting. Please follow us on ABS Television Radio on Facebook.
Yes, as he said, as Garfield Burford from ABS Antigua and Barbuda. And Ms. De Freitas, as we close this segment, what is the next step forward for tutor? We had the pandemic leave being, the announcement today. What would be the next steps of tutor on these matters?
Well, tutor would again seek to meet with the Ministry of Education. Hopefully the Ministry of Education would on this occasion accede to our request for discussion. We would want to see the decision taken by Cabinet in terms of the pandemic leave, because that would definitely impact our teachers or ancillary staff and so. And we stand to be guided by what the Ministry of Health says. And therefore, we will guide our members accordingly and hope that teachers, students, and parents would act responsibly.
Okay, thank you very much, Antonia De Freitas, tutor. And we have on set Dr. Mohammed Rahman. We're going to take a break now, and when we come back, we'll be joined by Steve Dipty, who is the president of Rajiv Dipty. I apologize. I keep getting his name wrong all the time. Rajiv Dipty, president of the Supermarkets Association of Trinidad and Tobago. So we'll be right back.
The COVID-19 virus, previously called novel coronavirus, is part of the family of viruses that includes the common cold and other respiratory syndromes. Protect yourself and loved ones from COVID-19 by washing your hands with soap and water or using an alcohol-based hand sanitizer. Avoid close contact with persons who are sick, and by covering your nose and mouth with disposable tissue. When you cough or sneeze, discard the tissue immediately or sneeze into the crook of your elbow if you do not have a tissue. Ensure to thoroughly cook meat and eggs before consumption. If you develop fever, cough, or difficulty breathing after coming from a country with the COVID-19 virus, please seek medical attention at the nearest health institution. Remember, prevention is the most important action you can take to protect yourself and your family from getting COVID-19. A message from the Ministry of Health.
I kept saying 20 seconds after putting soap on your hands. Okay, I'm going to teach you again. We go top, do this, and then just swap hands. Then, the opposite direction. I think you're about 17 seconds, 3 more seconds to go. There we go, 20 seconds done.
To TV. Starting March 22nd at 8 p.m., watch the popular Trimbago soap opera with Trinidad and Tobago's 2020 Road March winner, Kester Fantala. You don't want to miss the epic drama on TTT. Live for local.
I'm a fashion designer from Trinidad and Tobago. I've traveled the world showcasing what we have to offer in the Caribbean. We are such a rich island with so much diversity. How can we understand who we are without seeing our own stories on television? My name is Claudia Pigas, and I believe our stories start right here on TTT.
Good evening again. I'm Wesley Gibbings with more on COVID-19. And I'm joined on set now by Mr. Rajiv Dipti, who is president of the Supermarkets Association of Trinidad and Tobago. And remaining with us is Dr. Mohammed Rahman, who is PRO of the Medical Association of Trinidad and Tobago.
Thank you, Wesley.
Welcome, Rajiv.
Thanks for having me.
Have your members been engaging in price gouging?
No, I can fully assure that none of my members of the Supermarket Association of Trinidad and Tobago are involved in price gouging at any level. They hold themselves to a very high moral obligation to serve their communities, and those stores, the relationships that supermarkets build with their customers is one of trust. We have our long-standing customers who come into the store, and if they feel that we are severely inflating prices to take advantage of a situation where paranoia has set in, that would not be beneficial for us in the long run, as we have taken a tremendous amount of time to cultivate these relationships. In addition, the supermarket industry is one that's very competitive, so we try very hard to keep these prices at a level that is competitive for all of us. The reality is right now, we have seen a lot of panic buying. We've seen a run on toiletries, hand sanitizers, Lysol wipes, disinfectants, Clorox. As one category of cleaning products has been cleaned out, they move to the next, because there is that level of paranoia with trying to get as many cleaning and sanitary supplies. We've seen toilet paper, water, bottled water, these items, cricks moving very quickly out of the store. And I think that where there is that scarcity now and this level of paranoia regarding COVID-19, you see some customers, they would be willing to pay over the top, and there would be some supermarkets, not some random supermarkets, taking advantage of what is a precarious situation for the customers.
But do you see the association setting up some kind of mechanism to monitor this kind of malpractice? Now, you've suggested along the way that not all supermarkets are members of the Supermarkets Association.
Correct.
So there might be.
Well, yes, we have a vetting process for our stores. Yes. We want supermarkets who have a high level of corporate social responsibility to be part of our association. We don't want members who have any malfeasance or malpractice or any adverse pricing strategies. That again, it's a competitive market, but at the same time, our members, I'm very proud to say, they have a tremendous level of corporate social responsibility, and my members do lead the way in their communities. This is a situation where you will find that some supermarkets, if they have the products that customers are chasing, they will be taking advantage of it. But we've seen around the world, on Amazon and eBay, for example, where some accounts by persons have been severely bloating hand sanitizer, for example, and medical gloves, and we've seen that those accounts have been erased and deleted by the administrative authorities, so they are being dealt with. I have encouraged customers to report any delinquent supermarkets to the Fair Trading Commission. We are also keeping an eye on it as well. We take the reports seriously. We pass them on to the Ministry of Trade, with whom we have an excellent relationship, and we try our best to see what we can do to keep the pricing consistent.
With the panic buying, have you been able to replenish stock in a manner that's satisfactory to you?
That was a situation that was born a mix of variables on the day. On that day, PriceSmart started to ration, 3 in each, and we saw items like rice, sugar, bottled water in that list. And obviously, when you see a company like PriceSmart on a ration, it's going to create a panic. Incidentally, that same day, our first case of COVID-19 was announced. When stock was depleted at various PriceSmart outlets, it spilled over into the supermarkets, and up to it has slowed down today, but up to this morning there was some level of panic buying, and we've seen a tremendous run, like I said, on toilet paper and cleaning products. I think people have a high level of panic where they want to be able to. What we're advising people to do is to stock up to the level where if there is a a quarantine of some kind, that you have enough canned goods, you have enough bottled water, that kind of thing. We have been, I mean, I understand that that hand sanitizer, there's a shortage in that, but I mean, there are local companies that are producing it. They need time. There are orders coming through, I understand, through suppliers who are bringing it in. That those are items that, you know, we'll have to hope for that comes before the end of the month. And in terms of the panic buying, we don't want to encourage it, because, you know, you're creating a gathering, a cluster of people, and it's not an ideal scenario for our staff, for the customers, to contain prevention of this disease.
Now that you've raised that, you know, Dr. Rahman, you know, there have been suggestions regarding the safety of consumers, purchasers, and also members of the staff in these public places, supermarkets and so on. What's best practice from your standpoint in terms of things that can be put in place to protect consumers and to protect the workers in these supermarkets?
Well, first and foremost, the prevention of COVID and any viral illness infection spreading is very personal, it's very individualistic. So it's down to everyone to actually wash their hands, to make sure to follow basic hygiene and precautions. If you have to cough or sneeze into your upper arm. Wash your hands, use hand sanitizer before you touch your face. Otherwise, don't touch your face. If you're sick, stay at home. So in a supermarket setting, we have to, first of all, remind everyone that this is an individual thing. Primarily, it's up to you. What can these supermarkets do? I've heard many suggestions, and there are little problems with a lot of them. Some people have suggested gloves be worn in the supermarkets, but there's a problem with that. You see, more often than not, these are transmitted via what we call mucous membranes, so inside the eyes, the nose, or the mouth. And if you put on gloves as soon as you go into a supermarket, one, the person who may have a viral illness, maybe COVID, maybe something else, they may continue to touch their face and continue to touch the item. So the gloves actually won't protect them. Also, I could dip my hand into a pool of COVID, take it out and wash it, and I'll be fine. It doesn't cross through the skin. So the gloves aren't adding any real protection. What's much better than that is somebody washing their hands before they go into the supermarket, not touching their face and not touching the other things in the supermarket. One thing that might be feasible, and I've seen it in some countries, is hand sanitizer inside of the supermarket. But then there's an issue. There's actually, I understand there to be a shortage of hand sanitizer in the country. So that may be logistically difficult to offer. But really it's something that has to be a very individual thing. I'm not sure that there's anything particular that they can do aside from retrain the staff on basic hygiene, have signs up, remind people of what's important, and if possible, hand sanitizer. So facilities to wash and dry hands.
I want to piggyback on his comments there, because he's making some good points. Now, I've noticed the Minister of Health would have said, you know, he would have remarked something about consumers having gloves, giving gloves to consumers in the supermarkets. I could say it's impractical from a logistical standpoint. The availability of medical grade gloves, that the disposable gloves, is simply not sufficient. I think the first priority is medical facilities for them, and there's already a shortage there. The second is the sheer volume of customers. At some of the most popular supermarkets in this country, you'll have something like about 4,000 people every day, right? So you need varying sizes of gloves in different, you know, distributions. Then, you know, we've done the thing, and let me make the point: those disposable gloves, they are not recyclable. We've had various talks about plastics in this country, right? So they're going to end up in the landfill, and that's not a good situation if you want to give it to every consumer. So we're creating more problems for ourselves with the gloves. In addition to that too, I think that there's a lot of good advice, just as Dr. Rahman is saying, being meted out by the sensible authorities in this country. So I think rational, good you know, behavior should prevail, and after that, common sense. Wash your hands. If you're going to handle the goods, you're still going to have to take off the gloves when you get them home. You're still going to have to handle the same goods. You're still going to have to sanitize and wash your hands and that kind of thing. I think the best thing is soap and water or alcohol-based sanitizer, as he would have said. We do have shortages. I mean, a lot of my members have created areas where they can wash their hands. You know, make sure we practice, we're training the staff at a certain level of interaction with the customer in the absence of a standardized protocol from the Ministry of Health, right? So that is something we definitely want to consider right now. I do not believe the gloves are an ideal solution for everyone because, as he pointed out, there's a lot of cross-contamination that could happen.
Right, and then the glove question. Let's stick on that a little bit because it might be linked to a sort of myth about how the disease is spread.
Yeah.
Right, because it's not going to enter your body through your skin,
No,
the skin on your
definitely
hand.
not. No.
Now, but the use of gloves is sort of going hand in hand with the use of masks. What's your view on the use of masks?
So masks is also a point of contention in the public among medical professionals. Is a very straightforward thing. If someone has symptoms of a viral illness, they should put on a mask to prevent spreading it to other people. If somebody is taking direct care of someone with coronavirus or COVID-19 and they have to take certain respiratory samples, they need to wear a special type of mask. Aside from that, medical professionals may wear a mask around the area to stop droplets from, that is when somebody coughs. You ever have somebody cough near you and then you feel something on your face, it's because it's left them and it's reached on you, that's droplet spread. So the mask can help in certain settings. However, for that to work, the person has to be trained on how to use the mask and how to put them on. And it doesn't go by itself. It's also accompanied by a lot of other personal protective equipment. And if not, the mask may actually increase somebody's chance of acquiring the infection. So imagine you've put this thing on your face, you're not accustomed to having it. The first thing the most of us do is scratch the face and scratch the eye. Immediately the nose starts to scratch. So you pull aside the mask and you scratch it, but then you've just introduced infection from someplace else. Or when you're taking off the mask, people want to grab the front and pull it off. But the front of the mask is where you've actually encountered the droplets from the environment. So in a nutshell, face masks should only be worn by healthcare professionals in certain circumstances, or if someone themselves has symptoms of a viral illness, they can wear a mask to help prevent the spread to other people. Otherwise, what they should do is cough into their elbow, cough into their upper arms, and stay at home. Try not to spread the infection to anyone else.
Now, I saw a photograph today from outside a supermarket in Jamaica. Or was it? I think it's in Jamaica, where somebody is greeting the people who are going in, and he's wearing a mask and he has gloves on and he has one of these things to take your temperature. Is that cosmetics and PR, or does that have any value at all?
That sounds very much PR.
Yeah.
Yes.
That sounds very much PR. It's a gimmick, and people lap that up.
Yep.
I want to urge customers to listen to a lot of what he's saying because that's a lot of common sense there. And I really think that the education of the customers, we are trying in the stores as well, but I want to touch on a couple other topics as well while we're here that I do believe needs to be direly addressed. One is part of this panic buying situation has implications for a wider food shortage in the country. Many of our suppliers are indicating, and again, you're getting different indications from different suppliers. The reality is that we listened to the Minister of Trade give her press conference, and you heard something about maybe like 2 months cover for NFM. That's oil and flour, yep. Right? We have deep concerns that some of our suppliers have different challenges. Now there are trade disruptions, right?
Yes.
We're getting our sugar, some of it from Guyana, but there's a situation over there. Some of it might come from Belize, but there's a situation on the ports over there. So there are trade disruptions all over. Some of our suppliers have foreign exchange issues, right? Now, it's a situation that could become dire if foreign exchange access is not freed up for the importers in this country to get the US dollars, to get the goods in, because we want enough food security. We want more than 2 months cover so that the general public does not start to panic.
But I think are things being put in place by this sector to identify alternative sources?
Well, yeah, of course we are alternative. We have identified alternative sources. We've gotten very creative, and I understand. Kudos to the importers and the suppliers. They are getting very creative, but the challenges they're facing are very dire. Let me give you an example. In Germany, they would have put aside a fund to hedge against this kind of risk. I think the U.S. administration has done something similar. I think what we need to be looking at is establishing a US dollar fund for our importers and suppliers to be able to get access to the foreign exchange maybe via Exim Bank and maybe do it at favorable rates in TT dollars for repayment. But let's support them. Let's get a facility in place for them so that they can get more food security for our customers so we don't have to worry about that now. Also, if this is a situation that can become more dire, as we've seen in countries like Italy, where supermarkets and pharmacies have become essential services, we are all preparing to really work hand in hand here. I think we need to have deeper discussions with the Ministry of Labour and their people, because we work the longest hours with the most amount of labour intensive in any sector. Right? So I think we need to look at conditions for our workers. I think we need to look at how we're remunerating beyond the rostered hours. These are all, very sensitive topics that need to be discussed, but in a realistic setting, because, we don't know how much this outbreak could escalate. There's a lot that needs to be done and looked at. With the reality is to, even with, if this turned into a national quarantine, let's just say it goes that far, right?
Yes.
Let's say the average working class citizen that is now a homeowner and paying a mortgage, is the banks going to waiver or let me not use that word. Are they going to postpone the term dates to suit? Because remember, these people are not earning. These are extraordinary times. It's an extraordinary crisis. This is the first pandemic that many of us are living through in our lifetime. So, if it goes a certain direction, we have to be considered to prepare to consider all these different alternatives, and remember, we already had vulnerable working class citizens in this country before COVID-19. The world economy was soft, and now it's even softer because of what's happening with the oil situation. And let me tell you how that affects goods as well. The cost of oil has gone down, but the cost of freight might have gone up because containers come back from China, and it's the cost of goods are going up. It's a situation that's volatile. It's creating an excess for suppliers. It will also encourage black market pricing. So we all need to have a serious discussion, sit down at the table together. The Supermarket Association is prepared to sit down with the distributors, the Employers Consultative Association, all the stakeholders need to get together as soon as possible to discuss all the possible outcomes, and let's work together to make sure that we provide a sense of normalcy to the public.
Right now, one of the things today it was announced that the concept of pandemic leave would apply in the public sector, with an encouragement by the private sector to follow suit.
Well, we looked at it. There are initial thoughts on it. I'm glad, first of all, that clarity was given to the public sector and the employees there, because they need that clarity. And we have full compassion as employers for our employees in the supermarkets. We have staff that have been with us a long time. We love our staff. We those of us who have really given to us, we take care of our staff. There is this notion that we are discompassionate as employers. That is furthest from the truth in the supermarket world, where it's a very it's a very tough business, and we have a real sense of appreciation for the staff there. There was a point made in the list of points that came out where you have to remunerate workers who cannot find stay home with their children, and you have to pay them. We're looking at this now as we're already struggling with the different services. What could happen to the ports? What could happen to the supermarkets? What could happen? How do we? If we have to pay them now, we have to look at a way of balancing it, because if we're going to be working longer hours, we want to see that how is this covered? Is it covered under NIS? What's going on?
Are you seeing space for discussion of some kind of fiscal relief?
I think there needs to be a discussion, because I think this is going to cabinet on Tuesday. I think that something similar went on in the US, where the administration is now belatedly talking to the supermarkets about it. So I think that maybe some of that needs to happen here. Invite us to the table. Let us tell you what our experience is with customers, with staff, with the guys who drop in deliveries, the whole scenario, and let's have a really sensible discussion about it. I think you'll find that you'll get reasonable outcomes on all sides.
Okay, Dr. Rahman, we just have a few more minutes left, but we can't end or consider this to be a complete discussion until we deal with the myths surrounding COVID-19. Now, we have already addressed the issue of the transmission of the disease. What are some of the more outstanding myths you've seen emerging out of this period?
I've heard people, one of the very funny ones was that when we say that it can be transmitted through the eyes, and that means that, of course, when you come into contact with something and then you touch your eyes, you can derive the infection. People actually thought that it meant if you looked at somebody that you'd get the infection. That's certainly not something that's true. I heard another one about the importance of garlic and how garlic was going to prevent you from getting the COVID-19 infection. Also not true. No scientific evidence to back that. I'd heard some people also talking about this virus not surviving in heat. So if you took very hot showers, then, or if you stayed in a very steamed up room, that would mean you would not get the infection. That's also not true. The temperatures at which the virus don't no longer survive are much higher than those necessary for the body to survive. So that's not going to be a viable route of prevention. Also, I've heard that in hot or temperate climates that the virus would not survive more than a few seconds. That's not true. Certainly it won't survive quite as long as it would in a colder climate, but the fact that it wouldn't survive because it's a more tropical environment is not true as well. One thing that I want to touch on before we go, and if I could, is just to remind everybody why we're trying to prevent this infection. So you might be getting mixed signals. As is this a mild illness? Is this not a mild illness? Remember, for 80% of people, this is going to be a mild illness. For another 20% of people, or roughly 1 in 5, they're going to require some support. They may have to go into the hospital. They may have to see doctors. They may require oxygen. And a very much smaller percentage of them is going to require much more critical support measures, like intensive care units and ventilation and so forth. So what we're really trying to do is flatten the curve. That is, not let too many people get too sick too quickly. If that happened and everybody went about life as normal and we didn't try to close down some services, that means that the pie is going to be very big. So 1 in 5 of a very big pie is going to be a large number of people. And if all of those people suddenly descended upon the healthcare sector in any country, they would be overwhelmed. So the principles here in trying to follow preventative measures and hand washing and staying away from people when you're sick and when they're sick is in the hopes that we decrease the total number of people that have this and any viral illness, so the number of people that get very ill and need the help do not overwhelm the healthcare services.
Rajiv, Dipti, any final words from you?
I just want to say that I'm in full agreement with him. I really hope this turns out to be a mild illness because we want the economy to get back on track. We need the economy to get back on track. And we would love that in an optimistic scenario, this resolves itself within 3 months or less. But we want to remind all stakeholders that we need to prepare for the worst as well. So, we need to start our planning proactively.
Okay, thank you very much, Rajiv, Dipti,
Thank you, Wesley.
Dr. Rahman, for being with us. Earlier, we had Antonio De Freitas, who's president of Tutor. In this seat tomorrow, you will see Vidya Ramphal, and he's going to be discussing the impact of COVID-19 on the sport arena. And also to announce that the Prime Minister, Dr. Keith Rowley, will convene a special cabinet meeting tomorrow morning at 9 a.m. And that's going to be followed by a special post-cabinet media briefing at 11 a.m. So tune in to TTT Live, Talk City 91.1 FM, and on it, of course, through TTT. I'm Wesley Gibbings, thanking you for staying with us. All the very best. Stay safe.